So, welcome. I'm Sharon Ermel. I'm the Strengthening Hospital Response to Family Violence Project Officer based at Bendigo Health. I've been involved in this project since its inception in 2014, and today we're talking about the unique complexities of family violence in rural and regional settings. And this is really the how-to of how to actually present this module to clinicians within rural and regional organisations. So really, it is expected that clinicians will have completed Module 1 and Module 2 of the Strengthening Hospital Response training before undertaking this module, and that way they've got the understanding of family violence. Okay, so now we actually move on to the risk factors in rural and regional communities. Now, there's 8 slides here, and there is some risk factors that are actually also discussed previously as strengths. And so that paradox can provide a bit of a conundrum for people. We talked about small town intimacy as a strength, and now we go on to talk about it as one of the risk factors for family violence and in dealing with family violence in rural and regional communities. Highlight that these are based on research, not just anecdotes, and you can ask the participants what they believe are the risk factors for family violence in their community as well. Bring your local knowledge of your health service and community into these slides, and you can provide very personal detail, very personal stories around this, your experience of dealing with family violence in this environment. So I'll just go through, I'm not going to go through these one by one. There's enough detail in the facilitator notes for you to refer to, and as I said, there's some further reading that if you need to expand any knowledge on any of these. When you get to the risk factors around firearms, it's a good opportunity also for you to discuss what your local policies and procedures within your organisation are. What sort of risk assessment do you do for staff who are going out into the community? So it's a good way of tying it into the content of the slide. So this slide around geographical isolation, there's been some overlap with service provision, as I said. So just be mindful of that. They're not clear-cut delineations between some of these. Things like you can talk about the lack of transport, and you'll have that personal knowledge around what transport options there are for people. And you can talk about the challenges in services and where the black spots are in your community, which you will be very mindful of. Again, finances, there's a lot of detail in the facilitator notes around this. And the content and what you talk about will depend very much on your particular community. If you're not a big farming community, then it may well be less of an emphasis there. So this is the service provision slide, and the key point here is really getting across that in rural and regional communities, the access to family violence specific services can be scant, and using the strategies of going out of area or getting services that cover the whole state involved are paramount. The next slide, cultural norms and values. Again, your knowledge of your community and your health service will be paramount to this. Your participants will probably come up with other cultural norms and values as well, and if you've got time, it's good to be able to discuss these, because part of the approach to dealing with family violence and being able to respond appropriately is for staff to be aware of their own biases and be able to put those aside and be able to deal with that. So the next slide, diversity. Again, how diverse is your community? You may well have a small community of Karen people or another nationality, refugees who have come in, who you can actually talk about as well. Also LGBTI community members are also another diverse group to actually discuss. And natural disasters is the next slide, and this is it. We refer to the Black Saturday fires of 2009, but there may well be other natural disasters local to your area that you can actually talk about. And there's been some research done around this area in the Macedon area that you might like to refer to as well. And that really brings to an end the risk factors of family violence. So then the next slide is ask yourself. The key message really is only 20% of cases get reported to police, as I said before, but 80% of people experiencing violence intersect in that with the health sector, whether it be the local hospital, whether it be their GP, community health. So we have that opportunity, and this is a key message to get across to participants. We have an opportunity to make people feel safe and encourage them to disclose. So you can actually then ask the participants, what stops you from disclosing? And in the facilitator notes, there's some suggestions around what they might come up with, and they may well come up with others as well. And it's an opportunity to actually workshop some of these and come up with some strategies around that. Ideas of how to what areas could be made private, how to engage other staff to actually get someone by themselves, so you can actually ask the question. The next slides after this actually go through, just highlight this 6 steps of sensitive practice, just as a bit of a refresher from the previous module. Now, ask sensitively. This is just really a refresher on the important considerations that staff need to take into account before they actually start asking the questions. Things like establishing safety, making sure that they're alone, engaging other staff if they need to be, and that if it's not safe to ask the question, then don't. There are a number of case studies that have been put together for the rural and regional module, and these may be suitable for you to use in your organisation, or else you could actually adapt them a little bit, especially for the area that you're working with. So there's some around urgent care, there's some for community services. So adapt them for your service. If time permits, you could split your participants up into groups and get them to work through a different case study each, and then come back to the room and present or talk through the issues that they found as you go through the 6 steps. Or else it might be that you just pick one case study and work through that as a group. If time doesn't allow, you could actually use the case studies as part of a reflective practice session or a second or subsequent education session. And really this is what you're trying to get the participants to think about. What are the unique rural and regional risk factors in our health that affect our health service and the people who access our health service? As clinicians, what are the personal and professional dilemmas that we actually face? Getting staff and clinicians to think about these issues and dilemmas and nuances better prepares them for when they're confronted and need to actually ask the question, when they identify someone who is at risk or experiencing family violence. And it's also an opportunity to role play, get them to ask each other the questions. How would they approach it? What wording would they use? And they become more comfortable in asking those questions. And so then this brings us to the referral options and pathways. And you as the facilitator should be aware of what your referral pathways are, and this is what really should be in your policy and procedure. So at this point you could be directing clinicians to where to find that policy and procedure and outlining what's in it. It's also that opportunity to actually talk about alternative referral pathways, you know, thinking outside the box, as we sometimes need to do in rural and regional communities, using, you know, GPs in other towns, etc. So you bring your knowledge of your local and not so local services and resources. Also, being involved and keeping in touch with family violence service providers or other specialist services can keep you abreast of what's happening in the sector as well. So it's a bit of a two-way street. If you're if your organisation's setting up referral pathways, engage with the people who you're referring to those services, and they will provide you with resources and keep you in touch of what's happening, even with the Royal Commission outcomes. And so then this really brings you to that ideas for community involvement, and it's a natural progression really. Talk about, are there any opportunities for community-wide family violence awareness, and if, you know, that engagement with local services, and how these could be explored. And take the opportunity to talk about work that's already being done in your community as well. So then this really brings us to the key messages. As a facilitator, you really bring, can't reiterate this enough, you bring your unique knowledge and experience to this group, and you share it. It's reiterate that clinicians and staff need to be mindful of their own biases and what they bring, and to recognise the strengths that they have as clinicians and their organisation. Also reiterate the use of secondary consultation, so that staff are not expected to undertake this work alone. And they're also not expected to be family violence experts. It's about giving staff the skills to actually identify potential family violence cases and to be able to respond and refer appropriately. And so that really brings us to the end of it. And take the time where possible to actually ask the staff, the clinicians, So what stood out? What forms of professional consultation reflective practice is available? And again, you'll be able to nut that out. Ask them how will they apply what you've covered today in clinical practice. And then potentially, down the track, a month, 2 months later, running sessions around has practice changed? Touch base with staff and be able to ask them, how's it going? Have you had any cases where you've had to use sensitive practice? Although having said that, sensitive practice can be used at any time regardless of disclosure. Sensitive practice is really about person-centred care with a trauma-informed lens. So we should be able to use it in all cases.